Let's talk about something that's pretty terrifying to think about, a serious eye injury. What would you do in those first few seconds? Knowing the right moves in those critical moments can literally be the difference between seeing for the rest of your life and not. Today, we're going to walk through exactly what those moves are.
And seriously, that is not an exaggeration. The stakes are just incredibly high. An accident can happen in a blink, right? At work, at home, playing a sport. But it's what you do in the moments right after that can change the outcome completely.
So, how are you supposed to remember all this stuff when you're in a total panic? Well, we're going to break it down. We'll look at 5 different scenarios, kind of like 5 mini mysteries. And by solving each one, we'll build a simple emergency plan you can actually remember when it counts.
This brings us to the one big idea that covers everything we're about to talk about. Your very first decision is almost always the most important one. You get that first move right, and you've already paved the way for the best possible outcome.
Okay, so let's start with injuries to the surface of the eye. Now, this is a situation where your gut instinct might totally betray you. Making the wrong move here doesn't just not help, it can actually make things a whole lot worse.
So picture this. Someone gets splashed in the eye with an industrial cleaner. The pain is off the charts. What do? Your first instinct might be to, find the right stuff, like some sterile saline solution, or to stop and try to figure out how bad the damage is. But look at the right side of the screen. The right action is one thing. Irrigate. Right now, with whatever clean water is closest. Tap water, a water bottle, anything. Because in this moment, time is vision.
And here's the why behind that urgency. You are literally in a race against time to flush that chemical out and get the eye's pH back to normal. So you start immediately. No waiting. You use a ton of water, just keep flushing for at least 30 straight minutes. The goal is just to get that pH back to neutral. Only after you've done that crucial first step do you then shift your focus to getting to a doctor.
All right, let's move on to our next case. A construction worker is using a grinder, and a tiny little metal sliver flies into his eye. It's been in there long enough that a little rust ring is actually starting to form around it. So, what's the play here?
So the most important thing here is actually what not to do. First, whatever you do, do not rub the eye. You're just going to grind that fragment in deeper and cause more scratches. And second, don't slap a pressure patch on it. I know it seems like the right thing to do, but it can actually trap bacteria and make an infection more likely. This is a job for a professional. An ophthalmologist has to be the one to get that fragment out. And just as importantly, scrape away that rust ring so the eye can heal clean.
Okay, now we are leveling up the severity. What happens when an injury doesn't just hit the surface, but it actually punctures the eye itself? In this case, the first aid rules change completely. It's all about protection.
So here's the scene. Somebody's hammering a nail, maybe a tiny piece flies off, and now they notice a little clear leak coming from their eye. What in the world is going on? That little leak is our huge clue.
That leak actually has a name. It's called a positive sidal sign. And what you're seeing is the internal fluid of the eye, the aqueous humor, literally streaming out through a hole. When you see that, you know without a doubt the wall of the eyeball has been breached. This is a full-blown surgical emergency.
Because the eye is literally open, putting any pressure on it is a catastrophe. It can actually squeeze the contents of the eye out. That's why the rules here are all about what not to do. Don't pull anything out, don't put a patch on it, don't even try to check the eye pressure. Your one and only job is to protect it. Put a rigid shield over it. Even the bottom of a paper cup works in a pinch. The whole goal is just to get that person to an operating room without putting any more pressure on that eye.
Okay, let's pivot to a totally different kind of injury, blunt force trauma. Think about getting hit by a ball or a fist. There might not be a cut or an open wound, but the damage happening inside the eye can be just as serious.
So, our case, an athlete takes a basketball right to the eye. The impact is so hard it tears tiny blood vessels inside the eye, and blood starts to pool in that front section. The medical term for this is a traumatic hyphema. And the big danger here isn't just the first bleed. It's the risk of a rebleed a few days later, which can be way, way worse.
And this leads us to a really, really important decision about pain management. I mean, obviously the person's in pain. But there's one super common, over-the-counter pain reliever that is absolutely off limits here because it makes that dangerous rebleed much more likely. Any guesses which one it is?
And there's our answer. Take a look at that top row. NSAIDs, that's things like ibuprofen, Advil, Aleve, they are a huge no-go.
Why? Well, they're mild blood thinners. They mess with your body's ability to form clots. And if you have an active bleed in your eye, the absolute last thing you want is to take something that makes it harder to stop that bleeding. Acetaminophen, like Tylenol, is a much, much safer bet here.
Now for our last and most urgent case. After a really bad impact, the person's eye is visibly bulging out. Their eyelids are swollen shut, their vision is fading fast, and the pressure inside their eye socket is shooting through the roof.
When you see all of those signs together, it points to one terrifying diagnosis: Orbital Compartment Syndrome. Basically, there's so much bleeding and swelling behind the eye that it's squeezing the optic nerve and cutting off its blood supply. Any delay here is measured in minutes, and it can cause permanent, irreversible blindness.
And here's the critical part. You can't fix this with pills or eye drops. The one and only thing that can save this person's sight is an immediate procedure to release that pressure. It's called the lateral canthotomy. It's all about physically decompressing the space to get the blood flowing again. It is the definition of a time-is-vision emergency.
Whew. Okay, we have covered some really intense situations here, from chemicals to punctures to massive swelling. So let's boil it all down into one simple, powerful action plan, a checklist you can actually bring to mind when every single second counts.
Here it is, your sight-saving checklist. If it's a chemical burn, you irrigate. Immediately. Non-negotiable. Got something stuck in the eye? Don't rub. Let an expert get it out. If you even think the eye might be punctured, shield it. No pressure. Zero. For a blunt hit that causes bleeding, it's rest, head up, and stay away from NSAIDs. And finally, if you see that scary, severe swelling and vision loss, you know what that is. It's a surgical emergency that needs urgent care right now.
You know, we've spent all this time talking about what to do after an injury happens, but the single best treatment, always, is prevention. So the last thing I'm going to leave you with is this question. You only get one pair of eyes. Right now, is your safety eyewear within reach?